Alright, so we are doing more with our pharmacology PowerPoint. And one thing we did was we went over these abbreviations, which most of them are on our common terms sheet. Not all of them, but most of them. So what I want you to do at home, and we just finished doing it here almost, is to make a foldable with this list. So if you just get a piece of paper and fold it hot dog style like this, and then you can just use a pencil to mark so that you have enough little folds for each abbreviation. And then when you open it up, when you're studying, you're like, oh, I have no idea, I can't remember what PRN is. You open it up and the definition is there. So go ahead and send me a picture of that today. And we're gonna move on. So this is something I would start studying it now. All right, a little bit each night, and use this foldable to help you. All right. There is something called a pill counting tray. All right, and that is this right here. So a pill counting tray allows you to dump the pills onto this platform here and use a spatula. That's what that's called. I know it's not like a cooking spatula, but it allows you to move that into this channel. I'm going to show it to you when we fill meds pretend out in the lab. But the reason this is nice is that you don't get your greasy fingers on the capsules or the pills, because your oils in your skin can actually start to like break down the capsules. Also, if your hands are dirty, the animal's going to ingest that pill, right? So if you had some sort of bacteria on your hand, now you're not handling it at all. It's just all on the plastic. So that's called a pill counting tray. When you guys take NOCTI, that will be on our hands-on part of the NOCTI exam. So we'll practice that out in the lab. All right. So we are going to look over prescriptions now. All right. And that's why we made this foldable, is because we have to be able to break down those abbreviations so that we can then do math and then fill the medicine, okay? So, we're gonna do two problems. The first one is 1 PO BID for 10 days. So if you think in your head, I've got 1 tablet, I'm gonna give it how? By mouth. BID, how many times a day is that? Twice a day. For how many days? 10. So what math that would be is 1 times 2 times, how many is that? Okay. So if you want to write down 1 times 2 times 10 equals 20, that's how it's going to be the rest of your life. Okay? The number of tablets times how many times a day times the number of days. Okay? So we can't give this to the client, right? They're not going to be able to understand that. So we need to put it in easy to understand words. So does someone want to take a stab at how they could write on the pill bottle for this pet? Carly, what do you think?
Give 1 pill orally twice a day for 10 days.
I like it. Does anyone have a different way? There's a couple different options. How else could you say it? She said orally. What's another way to say orally? By mouth. So she could say, give 1 tablet by mouth. And you said what, twice a day? What could she say other than twice a day? Every 12 hours. So there's 12 hours plus 12 hours is 24 hours for 10 days. All right, so what I wrote down was just give 1 tablet by mouth every 12 hours for 10 days. So again, there's a little bit of variation there, but I have how many tablets I have how do I give it, how many days, and how long. That's the requirements of 4 things. The number of tablets, how many times a day, how I give it, and how many days. 4 things. So why don't you try to do the next 2? It says 2 POSID for 14 days. So I'll give you a minute to try that one. Alright, so who wants to break down the math for me? Go ahead, Lexi.
2 times 1 times 14.
That's right. Good. 2 times 1 times 14. 2 times 1 times 14. You will have a calculator for the test. Okay? So we got 28. Who can tell me what directions they would write? Someone new. Amberina?
I said I'd give 2 pills once daily for 14 days.
Okay. Give 2 pills or tablets orally or by mouth once a day or every 24 hours for 14 days. Perfect. All right. All right. We're going to try some on our own now. So we're going to use our little whiteboards, okay? And don't get discouraged. This is why we're practicing it now before I turn you loose, okay? All right. Isn't that a cute picture? I think. Aw, Summer. Summer was my old cat. Summer Cook. And the prescription is 16.2 milligram. You're like, what? Cook, why are you talking about milligrams? It's just a tablet. Okay? That's the milligram of the tablet. It means nothing other than when you go to get it off the shelf, that's the milligram that you're going to choose. Okay? Does that make sense? So, 1 phenobarb tablet. PO, what's that? By mouth. BID, twice a day for how many days? Okay, go ahead and do the math. You can either write down the directions or do it in your head. I want to at least see the math that you came up with. Now remember, you don't have to worry about the 16.2. Just think of that as 1 tablet. Okay? So 1 times 2 times 30. 1 times 2 times. Okay, so we said it's 1 times 2 times 30. So what number did we get? 60. Basically 2 times 30, right? So 60. All right, so when we go to the shelf, we're going to see 16.2 milligram. Okay, that's what each pill contains. We're going to say there's 60 tablets. And what would you write for the directions for the client? Someone new. Natalie, you want to take a stab at it? Go back here. So,
Give 1 tablet of phenobarbital
So when we have this on the pill bottle, hi buddy, I'm gonna show you some like practice labels. The owner won't even care about this. It has to be on the label somewhere, that's all. So we can so just say 1 tablet every, every 12 hours for 30 days. Very good. Okay? All right, let's do another. This time it's Potter Pie. So Potter is going to have half a tablet. I know you all love your fractions. Half a tablet. PO, SID for 10 days. Half a tablet. PO, SID for 10 days. All right. So our math is half times 1 times 10. Now some students, as soon as they see the fraction, they panic. Okay, that's normal, it's okay. You can either change this to a decimal. So what would that be? 0.5, right? So you could plug this into your calculator, right? Okay. If you're more of a visual person, you can draw it. All right. So if I had, or Rocky, if I had half a tablet, so that would be 1 day, right? Another half of a tablet, another day, another half of a tablet, 3, 4, 5, 6, 7, 8, 9, 10, right? Half a tablet, half, half for 10 days, right? So how many is that total? 1 tablet, 2 tablet, 3, 4, 5 tablets. Okay? So whether you do it visually like that, whether you use a calculator, there's a couple different choices, but we should end up with 5. All right, who wants to give me the directions for the client? Juliana, why don't you try it?
Give 5 tablets by mouth.
How many times a day?
1.
Once a day? For how many days? How many? 10 days.
10.
Okay. But instead of saying 5, that's how many we're going to put in the container. How many are we going to actually give?
1/2.
Half. Yeah. So our directions is say, give half a tablet by mouth once a day for 10 days. Okay? All right, so this was 22.7 mg Baytril, and that's what you're gonna find on the counter. Cabinet, I mean, there's 62.5, there's all different kinds. 5 tablets. All right, Jackie, 250 milligram metronidazole, PO, BID for 14 days. Do we care about the 250? Not right now. Not for the directions. So go ahead and do your math on that. looks like everyone got it. So Natalie, tell me the math.
1 times 2 times 14.
Yep. 1 times 2 times 14, and what number did you come up with?
28.
28. Okay. Good. All right, so we would choose a 250 milligram bottle. There's also a 500 milligram bottle. All right, here's another. Woo! Okay. 1 SID PO 30 days. 1 SID PO 30 days. All right, what did we get? 30. 30. Okay, so Lexi, how'd you do that math?
1 times 1 times 30.
Yep, 1 times 1 times 30. So here was the tablet that we're going to look for in the cabinet. This is what the prescription looks like. Say they have the name of the drug, they have the concentration. All right. And this is the label that we practice with in here. Okay. So these directions that we've been doing, okay, the easy to understand directions are going to go right here. All right, so what would we say for that client?
By mouth. Yeah.
Go ahead.
1 tablet by mouth for 30 days.
And how often?
Once a day.
Once a day. Good. All right, so that is going to go right here. Easy, easy. That would go right here, okay? What is our drug? Yep, so the losartan, what concentration?
What did you just say, 50 milligrams?
50 milligrams, okay? I can't say this enough. When you do this on Nocti, when you do it on my test, you have to write the name and the concentration, okay? So that would be the drug. Losartan, 50 milligram, because we have to know which. When you're given this, like a tech might just throw you the label and say, can you fill this? So it's got to be on there, okay? Date, that's self-explanatory. What should the patient look like?
Name or like canine or
It would be the name, okay? But how many fluffies do you have in your clinic? A million. So what do we have to add to it? The last name. So Fluffy Smith, okay? And then doctor, what would the quantity be? That was in math that you already did. How many pills would I fill this with? Yeah, so there would be quantity 30. Does it say anything about refilling it?
6 times.
It does say that, yeah. So if there's a spot for refill, you would say 6 times. Most of them don't have refills. I don't even know what losartan is. It's a human drug, I'm pretty sure. But I stole it from the internet. Okay. All right. So, little mental break here. A little bit more notes. We have got to verify. What does that mean, verify? Confirm, double check, make sure we know the prescription. So a lot of times, I mean, you're going to be refilling a lot of the same drugs. You kind of get to know what's normal, right? Cats always get 62.5 milligram Clavamox. Dogs always get Rimadyl, but if they have liver problems, then it's Tramadol. Like, you just kind of start to become aware of it. Okay, right now, you don't know that. I mean, maybe Carly knows with her deer, like, this drug is going to be for that drug is going to be for that. It's kind of probably going to be this amount. If the vet said, Carly, give 5 mLs of this drug, but she always remembers only using 1 ml, that's when you would want to verify it. Doc, that doesn't sound quite right. Did you mean whatever? and they'll say yes or no, okay? Sometimes, we're more in the digital age now, but reading doctors' handwriting can be pretty hard sometimes. So it is actually sometimes nice that we're going more digital, you know, reading the computer instead of a handwritten file. But just ask, okay? You never want to give them the wrong amount because you were scared to ask a question. It's always better to be safe, right? Always better to be safe. Okay. Now, one thing that we have to have, this is going back to level 1 hood, we have to have a VCPR. Remember that?
Yeah.
Vet, client, patient relationship. You have to have that before you can prescribe any medicine. Have to. So that goes back to like getting checked out once a year, or even if they've never been there, like physically going in so that you can put your hands on the animal and evaluate them. You can't just say, Rocky hasn't been to the vet in a year and a half. He has an ear infection. Can you give me some drugs? Okay, it doesn't work that way, especially when you start getting into the controlled substances. Okay. Hello? All right. So, have you guys taken a leave before? Ibuprofen, Tylenol. Where'd you get that?
The store?
Which store?
Target?
Target? Where did you get yours?
Walmart?
I always go to Walmart. Okay. Did you have to go somewhere fancy, or did you just get it?
Just got it
Off the shelf, right? Just walked right up to it and were like, I feel like a leave today. And you grabbed it, right? Who's taking Percocet? Vicodin, Tramadol,
people who
huh?
people who have gone through like surgery and stuff, like who need the drugs for like pain and stuff like that.
Yeah. Have you ever had one? Have you ever had this medicine? Can I take on you? For your migraines? Alright, Juliana gets migraines, okay? But she tried Aleve, she tried ibuprofen, she tried, I don't know, Excedrin. Wasn't working, right? Not as good as it could. So did she go to the store to get her prescription strength migraine medicine? Where'd you have to go?
Doctor.
She had to go to the doctor, and the doctor had to give her a prescription, and then you had to go to the pharmacy, right? Even though she had that piece of paper, she still has to go to the pharmacy. I don't know, CVS, Rite Aid, Walmart even has it. But she couldn't just go to the shelf, okay? So this is over the counter versus, what do you think RX means? RX?
Pharmacy.
Close. Prescription. Okay, prescription, right? So over the counter is right off of the shelf. The doctor might say, hey, Juliana, why don't you try ibuprofen and Tylenol at the same time? Okay, that's not a prescription though, okay? You still can go right to the shelf and buy it. Prescription drugs have to be prescribed by the doctor. You've got to get a script for it. You're going to buy it at a pharmacy, in our case at the vet clinic. Okay, they have it at the vet clinic. And it's only intended for one person. So if I say to Juliana, man, my head is killing me, can I try one of your pills? She might want to say, yes, because I love you, Cook. But she should say, no, because that's just for me, right? Now if I ask you for Mountain Dew, that's different, okay? You should not share it. You should not share it, okay? A lot of this goes back to controlled substances, which we're going to talk about next. The other thing is, her doctor gave her that migraine pill. Maybe her liver and kidneys work great, but mine don't. And I'm like, Juliana, give me a pill. And I take this pill. The doctor didn't give me the pill, and I get kidney failure. Whose fault is that? Mine, right? So they know Juliana. They've run tests. They know her body. she can take this drug. He doesn't know me, or she, I don't know who your doctor was. All right, so these controlled substances are kind of interesting. We have to do two things with them. One is we have to lock them up in a safe. For real, in a safe. And this was my job when I was at the clinic. We have to do drug logs and log every single bottle that comes in and every single bottle that's finished, used up, or expired and discarded, and every drop that leaves a bottle, every pill that leaves a bottle. In our basement of our clinic, I mean, I filled out binders of these sheets, and down in the basement there's like this big shelf all over of all these binders. Yeah.
What is it says?
Which part?
Wait, go.
One more?
No,
Hmm?
go forward. I think it's that.
Oh.
Okay.
Never mind.
Abuse.
Yeah.
The reason we have to be so careful is because people like to abuse them. Alright? Get high off of them. Alright? And so you're like, what? People don't do that. No, like it really does happen inside your vet clinic. Okay? Yeah. So I'll tell you a story with that. The other side of it is you have owners who are like in love with Valium. Diazepam makes them feel real good. Okay? So what animal needs Valium? The seizuring animals. So you'll actually have clients come in and lie to you about their pets having seizures so that you send them home with Valium and they use it instead of the dog. Scary, isn't it? So, going back to that vet client patient relationship, we need to know our owners. Okay, you don't just give out these drugs. Okay? You can say go get some ibuprofen off the counter, that's fine, right? But Valium is another game. Morphine is another game. Propofol is another game. Okay? So you gotta be really careful. So, these have legal controls. We want to make sure they're not being misused. So the owner's not using the drugs instead of the dog. They sell these drugs on the street corner. And if it's traced back to your vet clinic, it's not going to look too good for you. I don't know, I mean, maybe this is on the next slide or something, but the DEA, have you ever heard of that? The DEA, the Drug Enforcement Agency, you know, they go in and like bombard a house with a SWAT team looking for drugs. It's the same people. Like as a vet, you have to deal with the DEA. And they come and they make sure that you have these drugs locked up, that you're keeping good records. Because they don't want these drugs on the corner. We already talked about the VCPR, and we talked about how to store them. And we have 5 schedules. This was the C that we were talking about on the ketamine insert.
Yeah.
And it said C3. All right, so Schedule 1 is not used in a vet clinic. We don't use marijuana. We certainly don't use heroin or ecstasy, but those are highly abusable drugs. Okay, pets don't use those. Marijuana, I don't know. You could probably argue with that. You know, they're legalizing it for people use. The farthest extent for that for animals is like that copaiba oil. I don't know if you've ever heard of that, but it's like an offshoot of marijuana. Cannabis oil, have you heard of that? Same lines. Okay, but you can just buy that right off the internet. Okay? But that's not the same as marijuana. So then we have 2, 3, 4, 5 is the lowest level. So that would be a terrible cough. You feel, you know when you cough so hard that your whole body just hurts? So you might have been prescribed codeine and cough syrup, or it's Tylenol with codeine. It's like a real heavy duty. It makes you feel warm and fuzzy, and you don't cough anymore. Okay, so you can tell it's pretty strong. I've had it before. Dogs can use it, not cats. But if you haven't heard of codeine, it's probably not likely that they're selling it on the corner, right? You've probably heard of ketamine and Valium and obviously marijuana and morphine. Okay, but codeine, you're like, that's because it doesn't have a high level. That's why it's a number 5. Some examples. One would be morphine. Where have you heard morphine before? Yep.
Like if you had a grandparent that was in the hospital and they weren't gonna last much longer, they gave them morphine.
Yeah. Morphine is like heavy duty pain med. And it causes a lot of like respiratory depression. So it really slows you down. It makes you feel really good, really comfortable. And so if you're, let's say your grandparent is on hospice, they're not going to last much longer, and it is almost time. Sometimes people can be given a little bit more morphine than they should be, right? We can't euthanize humans. They do fight for that in some states, though, which I think is kind of interesting. But morphine will maybe just help that along a little bit, make them comfortable when they do pass. In animals, we just euthanize them, right? You don't need no morphine for that. We already got euthanasia solution. People don't have that. But let's say we have a horribly painful orthopedic surgery. Orthopedic stuff is terribly painful. If you've ever broken a bone, it is like the worst pain. We can give morphine to animals for that. All right. Buprenorphine is a really nice pain med. Really nice pain med. We give that for spays and neuters and declaws. All right, but it has a high chance of abuse, so it's a number 3. Ketamine is a number 3. Okay, that was the monkey one that we had. That's, people sell that on the street corner. That's heavy duty stuff there. Okay. Valium, it actually surprises me that Valium is a 4. I thought it would be more abusable. I thought it would have been a 3, but Valium is used for seizure dogs. It's also used for anesthesia, sedation, but people use that very inappropriately as well. Have you heard of propofol before? Does it ring a bell at all? Do you remember where you heard that? No? Propofol is an anesthetic. It's an induction agent, so it induces the pet. It basically sedates you enough that we can put an endotracheal tube in and hook you up to gas anesthesia. When Eli bit his tongue off, we would give, we were in the ER and we couldn't get to the operating room because it was too long of a wait. So he had to be able to swallow his saliva and blood. So they could only sedate him enough that they could open his mouth and suture it. And then he'd start to wake up and they'd give him a little bit more. And then he'd start to wake up. So it just calmed him so that they could suture it up. Michael Jackson, his doctor prescribed propofol and he used too much of it and he died because of propofol. Okay, do you think there was a very good, it's not a vet, but client-patient relationship there with Michael Jackson? That did not go over very well. Okay, that doctor should have been monitoring that much more closely and Michael Jackson wouldn't have died. Phenobarbital is a seizure drug. Okay, that's a number 4. So lock and key and drug logs. You guys have questions about controlled drugs? All right, let's do one more thing and then we'll be done. This is a chart talking about substance abuse. I don't even know if this is on your notes. It might not be. I don't think it is. think it's just a little discussion. What happened when someone was found in a vet clinic to have a substance abuse problem? So I'm talking about those employees who actually were taking drugs and abusing them from the vet clinic, okay? Nothing happened, 10%, a little over 10%. The person sought treatment on his or her own, 15%. The practice mandated treatment. They said you have to have drug treatment, detox, go to, what's that called? Rehab. Thank you. Rehab. I just saw that in my 600-pound life last night. I should have known that. Because he was addicted to pain meds, morphine. Okay. Require you to go get treatment, rehab, whatever. 5%. Our clinic actually paid for this individual to go to rehab. They paid for it. And then she came back and it didn't work. The person resigned, close to 20%. The person was fired, off the charts. So what's the moral of that story? Don't do it or you're gonna get fired, right? I thought that was very nice to actually pay for her treatment. Substance abuse by veterinary individuals can have a devastating effect on animal care through distorted judgment. If you're on drugs, can you treat the animal properly? Come on, let's be realistic. In addition, it tarnishes the reputation of all veterinarians when such behavior becomes public knowledge. So here are some red flags. This is the red flags that we look for to see if someone in the clinic is abusing. Pages missing from those logs. That's fishy, okay? A claim that a bottle has been lost. How do you lose a bottle, right? Or, oops, I think I accidentally threw it away. Refusal by management to upgrade or even have a drug log. That would be a huge no-no if the DEA ever came in and said, hey, I just found your Valium bottle on the street corner. I traced it back to you. Where are your drug logs? Ooh. And then missing prescription pads. We actually had to kind of tuck away our prescription pads because if a client ever got their hands on one, they could just write their own prescriptions and bring it to Rite Aid or CVS. All right, let me see how much it is. Let's stop. Let's stop there. I want to show you something. We're all working on our syringe projects, right? Okay, fun, pretty project. Now what I want you to do is we're going to practice this math a little bit. Very, very basic, just like what we did on here, okay? Where you're going to find this practice, it's just 10 problems. I don't know, you might need a calculator. Go to level 2 material and click on tablet math. And it's just going to be matching. It was just easier to do it this way. So I would just do it on a piece of paper and be like, let's do this one together. 4 times, how many? 4 times 7. So what's 4 times 4? 16 times 7. What is that? Anyone know what that is? What is it? 16 times 7? All right, what's 6 times 6? Good job. 7 plus 3. 7 plus 3. So 106.
Why did I say 36?
Huh?
6 times 7 is not 36.
Oh no, I said 6 times 6. Oh my gosh. Okay, what's 6 times 6? 36 plus 6. Is it?
Yeah.
I know.
42.
Alright, what's 7 plus 4? Alright, so what number are we looking for?
104.
So just click on this. And there it is. Woo!
We would have figured it out by the end.
Yeah, we will figure it out eventually.
I do math a little bit weird. Like, I know 6 times 6 better than 6 times 7. So I'm like 36 plus 6, but I forgot to go up to 7. So there you have it. Okay, so do this for me today, okay? You don't have to come and tell me the answer or whatever. One time, because I want to see how you do on it, okay? Take your time. You can use a calculator so you don't mess up like Cook did. And then work on your syringe projects. All right? That's it.